And wonderful. So someone needs to start us off. So we encourage you, if you're keen to share your details, please feel free to put your name and your location and perhaps your institution in the chat if you'd like folks to know where you're coming from today. We're always kind of keen to see who's joining us. But yes, please feel free to use the raised hand function. We'll call on you to ask a question or to directly write the question in the chat.
I have one question.
Sure, go ahead, Shelley-Ann.
I'm just wondering if one of the expected outcomes of this particular project has to be sort of direct treatment of the beneficiaries, or can it be the actual, planning and collaboration and setup, let's say, for a clinic? Because we're looking at a year and a half. So obviously we couldn't get everything up and running by then, but we're wondering if all of the project management and the preparedness for it could be covered by this particular grant.
So there would need to be some monitoring of health impact. So there would need to be a sort of health or well-being improvement at the end of the project period that's being monitored.
Okay. Okay, thank you.
Not a problem.
Hi, may I ask a question, please?
Absolutely. Thank you, Samar.
Hi, thank you. Looking at the project itself and building up the strategy plan for the project, because due to the fact that we're based in Canada and it's going to be implemented in the MENA region, so we're going to be working with certain collaborators. How much information do you require at this very early stage when building, let's say, the plan for execution, one can say? Like, for example, we have, I'm going to give you just a broad example. We're going to be working in Jordan and in Tunisia, and we have so far one institution and three collaborators, project managers and coordinators in Jordan. And we also have several volunteers, and we have, for example, a coordinator in Tunisia. We have their CVs, we have some information about the organization itself. We have also the contract. Do you require more of that? What exactly is required to put in order to establish that? Do you need to plan thoroughly? I mean, how far is, how much is too much?
Gotcha.
Thank you.
Well, you'll note, Samar, that there are pretty strict character limits in the application because we really want folks to stick to the most essential components that they want to convey. And I would say that really important is going to be highlighting the key technical personnel or advisors. So whether that be at the institution in Canada through which you are applying, or whether that be folks that are seated within the collaboration, the collaborator institutions, or whether these are folks external to the direct collaboration, but are, offering advisory services. Really, the key team members that we're wanting you to highlight are going to be those who are going to be providing the strategy direction, the technical direction, perhaps those who have, I'm not sure if this is relevant to your project in particular, but just as an example, those who may have the connections to relevant government entities to enable the project to move forward, things like that. And that's what's going to be essential at this initial review, this initial application stage, so that the reviewers, particularly when we get to the peer review stage, have a strong sense that yes, this project, as you have outlined it, is going to be feasibly implemented given the expertise and experience being contributed to the project. At this point, we certainly wouldn't expect you to be providing, CVs for more administrative or operational staff. We know in many cases, if this is a newer project, those people might not even be hired at this point. So that's, we would expect that to come later. Well, if you get to the point of selection, we might, we will likely ask about that during the negotiation phase, but not at this early application stage. Is that helpful clarification, Samar?
That was a wonderful clarification. Thank you so much. Can I just add one thing so I can be crystal clear? I mean, I'm sorry,
Sure.
just because I'm processing, so I'm just thinking out loud. Because you've mentioned a key word over there when you said that we're still at the very beginning of this. We're going to be launching this, so it's not really tangibly on the ground. It's an innovative project. For example, like in our project, we're going to build the software. It's going to be an open access software. So how much detail do you require the plan of how to build the software? Or it's just, okay, the plan is we're going to build an open access software. We're in connection with this company, and just broad highlights. Or do you need a Gantt chart? How, I mean, what exactly, once again, how much is too much?
Totally understand. The high level, this is the company we're working with, we're developing it, it's open access. That's a really important point to make. This is, the purposes that the software is going to serve and how that ties into the delivery of the innovation, or is the software itself the innovative component, that those are the important pieces to clarify. The Gantt chart will, again, that is something, if you get to the selection, if you are selected at the negotiation stage, we'll work through a more fulsome Gantt chart. At this stage, there's a question in the application that talks about, the execution plan. And so it might, the level of detail at this application stage may be, by the end of the first quarter, we expect that the software is developed and being tested. And then in the second quarter, we will be, conducting, field testing and use of the software, and it will be improved throughout that second quarter. That's the kind of high level detail that we'd be looking for at this application stage.
Wonderful. Thank you so much. That's very, very helpful. Thank you.
Great. Thank you, Samar. Vera, I see that you, okay. Well, no, it's okay. We'll go on to, oh yeah. Okay. Is it Banush? Am I pronouncing that correctly?
Hi, yes, thank you. Hi, everyone, and thank you for this opportunity, Dominique. So I have a question. Our project is actually an add-on to the already existing project that we are implementing in Nepal. So what we are proposing as intervention is kitchen, like building kitchen gardens or working with the grassroots community groups. So that really depend on if we get the grant. The timing and like the season is very important. And I understand that we have like limited time for this grant to actually implement the project. But if we get the grant, we may need to wait for the next season to be able to implement. Would that be something that affect the review of the proposal?
It won't affect the review of the proposal. It'll affect, if you're selected, it'll affect the negotiation of the proposal. And that is something, when we're talking about these nutrition, projects that may address nutrition, that is certainly something that I understand will come into play, seasonal growing seasons and seasonal crops and things like that. So that is something that we would tackle the STARS team would tackle directly with the innovator team during the negotiation phase. I would say kind of in your application, outline broadly, Q1, Q2, Q3, you don't need to specify necessarily months, because negotiation is not going to happen for another several months. So this is something that I would suggest if you are selected and things do move forward, this is something that you would highlight to us very early in the negotiation stage so that we can work with you to say, okay, let's try to speed up negotiations so that we can get you implementing, as soon as possible, or okay, maybe we actually need to delay and so we can take a slower pace to the negotiation to put you at the better start date. But that is certainly something, because of how essential it is to the implementation and the success of the innovation itself. That's something we could work with you to address at that stage.
Thank you very much. Thanks.
No problem. All right, back to you, Vera.
Thank you. Sorry for before.
No problem.
Well, in fact, I have maybe 1.5 question. And the one question that I have is that we will be applying for a project in Albania. And I don't know whether based on, what we read, and we didn't, so that it can be a problem, but just to check whether Albania is a country
Yep, I just double checked on the country eligibility. So in Appendix A, yes, Albania is listed. So yes, it's acceptable to be an applicant country, but also to be an implementation country.
Thank you. Now the half question, if I may.
No problem.
Just a small clarification, this is why probably this meeting is about. What we are trying to do basically, because climate change, it's a global problem, right? It's not a country problem. It is a much wider thing. And we were trying not to tackle only health and mental health, where we are much more stronger, but also the preparedness of decision makers, which we think is sort of a way to, as pandemic found everybody, unprepared somehow. So this is the idea that we are going towards.
Yeah, and so you're trying to combine these two. We are trying portions,
to
right?
work on both, exactly, because you can't have,
Yeah, no, that is totally acceptable. So as long as the mental health component will address those health outcomes, but also the sustainability of ensuring long-term positive mental health outcomes will depend on the good decision making of leaders. So yes, that makes a lot of sense, and I would encourage that to go ahead.
Thank you so much.
Great, thank you, Vera. All right, I see a hand raised by Paul Unkundi. I hope I've pronounced that correctly. Please correct me if that was incorrect. Hi, Paul.
Yes, can you hear me?
Yes, we can hear you, Paul.
Okay, I have very short questions. I think they're like 4, but very brief. So the first one is about in the application that is like signing authority. I think you know that one. Yes, like in the case of an institution, like a university, there is a vice chancellor, there's departments, like you are from a specific department. Like in that case, who is supposed to be signing authority? Is it just the dean or the head of the department, or just university?
So that depends, Paul, entirely on the rules and regulations within that institution. So if, for instance, the dean or perhaps the vice chancellor are able to sign contracts on behalf of the institution, that could be on behalf of the specific college or the specific department, then that would be the person. So it's anyone who is formally able to sign contracts on behalf of the organization. Sometimes that's department based. Okay,
the
second question.
Yeah, second question is about the, like, it's in Canada and then in Africa. So we have what I saw in the application. Maybe I can go back. Sorry for that. Yes, no, okay. There is a project lead. Yeah, there is a project lead, and then there is an alternative contact full name. So this alternative is for like who? Because there's only one project lead. So
then that's fine. You can leave the alternative blank. If there's only one
Okay.
project lead, you leave the alternative blank. That's just, you know, if we wanted to offer an alternative contact in case, for instance, you're part of a really large organization and maybe the project lead is different than the person leading the application process. For instance, at large international NGOs, it might be one person who's formally going to be the project lead and doing the implementation, but they might have a whole different department of people who work on grant applications. And so in that case, an alternative contact. But if it's one project lead and they're going through the full process, that's the only name we need, and that's fine.
Okay, then there's a project lead maybe from Canada, but Canada institution is going to conduct this project in Africa. So where are you going to write this name for the person from Africa?
So you're talking about a situation where there's a collaboration between a Canadian institution
Yes.
and an institution based in Africa. Is that what you're suggesting? So if it's, so I just want to,
not an institution in Africa, but the person who is going to do the project in Africa, and then there is an institution from Canada. So the person in Africa is just a person, not an institution.
okay.
And now in Canada, we are using Canadian institution, where that is where we are coming with project lead. So where is this name from Africa? Where is it going to be listed?
So if the Canadian institution is the grantee applicant, right? Then the project lead would need to be someone from that Canadian institution. If you want to highlight the individual based in Africa who's going to be leading the actual on the ground implementation of the activities in Africa, then that person, I would suggest the best place to put them is in the collaborators section. So that should be just a little bit under the project lead section, or where you're listing the project lead, there should be a whole section called collaborators. And so you would put that person's name, I would suggest maybe putting their contact details and just a short blurb about, you know, their area of expertise or if they have any institutional affiliations.
Okay, perfect. So the last brief question. So when I was looking on the application, there is, I think, section 1. There was question 2 that is on, let me go there. This written, sorry for impact. That is A.
Yep.
There is questions. So there's question 2. So on question 2, I cannot see space where you need to write those. So there's no like space. And I remember I sent email, I did not get a response concerning that.
So section A, question
That is on
2. You're having on the application form in flux,
There's
you're
no
having,
space.
Okay, I'm writing down your name, Paul, and I'm writing down this because we're gonna have to follow up with our flux team to figure that out. I'll follow up with you via email on that because that might be a broader issue.
Yeah,
so
are you able to see that?
Yeah, I can't see it on Flux right now, but we'll follow up and we'll get back to you via email on that. Okay, Paul? Thank you for flagging.
Yeah.
Any other questions? We got you?
No.
I'll finish. Okay.
Thank you so much.
Thank you so much, Paul.
Yeah, bye.
Okay, Lucy, I see you on my screen now. Please go ahead. Oh, you're still muted, Lucy.
Yeah, thank you very much, Dominic.
Thank you.
My question is in regard to patents.
Okay.
We plan to work with a business partner who has been already putting into the market a formula for a high nutrient product, has been working with us for a very long time and has been providing free meals for the children that we're going to work with, children with disabilities. Now we are going to work in partnership as collaborators, and they are concerned that when I read about the patenting, I'm not able to answer their question on, does that mean that from now on their patent goes online after these?
No, okay. Ooh, this is a big set of questions, Lucy. So I think that No, we would never put their patent online. No, GCC would never try to own their patent. So I think I can clarify those two big things. I think we probably need to engage our legal counsel to make sure that we can adequately address the questions of your partners. So my suggestion would be for you to send us an email. Feel free to loop them directly into to loop these partners directly into the email, and then we'll address very specifically their questions and loop in our legal counsel as needed to make sure they have full clarity and they have confidence, you know, going into this. But we would never, you know, require them to make their, you know, their patent or their proprietary information available online. GCC would not seek to take ownership of those patents or IP rights or anything of that nature. The most we might do is ask them to sign a sort of licensing agreement or more broadly adhere to our global access requirements that just seek to ensure that those in the most vulnerable populations within low-income countries have access, but it sounds like they're already prioritizing doing that. So yeah, let's follow up via email to address the specifics of that, but I hear where you're coming from in those concerns.
Okay, then. Thank you very much.
Okay, thank you. I see another hand from, is it Ileana Leon?
Yes, Ileana. Thank you, Dominic. Hi, everyone. I have 3 questions. I'm going to try to make it fast. So would you value and allow to add links as part of our answers other than the reference at the end of the proposal or at the end of the questions, such as links to, let's say, the LinkedIn profile of our team members or something like that?
You're suggesting in the reference section of the application form?
Other than the reference, let's say when we look at our team members or project management team, would you value and allow links to their LinkedIn profile or something?
I would say there's nothing preventing you from doing that. I would suggest that you don't rely on the reviewers clicking on that. So like my suggestion would be to include the most key information about the team members, for instance, in the text in the body of the application. The reason we set, you know, constraints, character constraints, is to try to level the playing field. Also to ensure that we're not overburdening our volunteer reviewers as well. So while you can certainly add those links, I would say I can't guarantee that reviewers are going to actually click on them and look at them.
Thank you, clarify. So the second question is, how many projects will you award or at least estimating to award during this call?
We're expecting to award about 30 grants as a result of this particular call.
Thank you. And last but not least, while building our proposal, we found that our targeted issue which is focused on mental health, is not necessarily a priority for the implementation countries. These are low-income countries, and they're focusing their limited resources to the obvious situations such as water scarcity and CO2 emissions, etc. So as our approach is not stated as one of their priorities, our opinion is could be more interesting for you as an institution, since it's not being addressed for the local government and international organizations. Is that correct, or what is your opinion on that?
Right, and Ileana, am I correct in assuming this question is sort of coming from, there's a question in the application form about whether it's a national priority, right? Okay.
Yes, yeah. It's one of the last, actually it's one of the last of the impact section, if I'm not wrong.
Yeah, okay. So that question, of course, there is benefits if you're addressing a challenge that is prioritized by a national country government. There is benefits in terms of the potential for scaling and sustainability, where the government, you know, the public sector could essentially buy in and support scale up and sustainability, right? So there's that's sort of one consideration. The other consideration is, of course, national governments, especially within low middle income countries, there is limited dollars. So they need to prioritize certain challenges. They can't do everything at once. So yes, there is a role to play for innovators in the space and for our dollars to go towards supporting innovators in the space to address issues that are of great importance, but that might not be where government's allocating their dollars due to other priorities. The big, I think, question is, does the government, recognize this as a challenge or an issue area, even if they're not, prioritizing it, especially through the budget? Is it being recognized as a real problem in country? And is government, are you going to encounter problems with the government? That kind of is more relevant to some of the other areas that GCC funds, such as sexual reproductive health and rights. If a government is not supportive of it is pushing an abstinence only curriculum, for instance, but so if that's not going to be an issue, then we don't really have to worry about that. So it's really, as long as the government is not going to push back, you're not going to encounter challenges from the country government in terms of moving forward with the implementation. That should be fine. And then in that section, you can also speak to, whether the government actually recognizes this as a challenge, even though they might not be prioritizing it or putting budget dollars towards it. Does that?
Perfect. Yeah, clear enough. Thank you very much, Dominic.
Great. Thank you, Liana. Okay.
So Dom, before we move forward, I just want to flag that we've gotten a few questions in the chat that I put in the document.
Okay, let's address a few of those then. Thanks, Gloria. Okay, so I see a question from Chilumba from iPass. So first, what parameters will be used to qualify innovations? So Chilumba, I would suggest that you take a thorough read of the RFP, particularly, section 3, 3.3, 3.4, and 3.5, which outline eligibility criteria, as well as the innovation screen criteria and external peer review criteria. The criteria by which all reviewers are going to be considering the applications are outlined directly in the RFP. So you can be completing your application as you take a look at the criteria by which the reviewers are going to be considering that application. So that is what I would refer you to. If you have specific questions or you would like to better understand some of those criteria, please let us know and we can try to address that. Secondly, do you fund innovations that you have already funded, assuming the innovation plans to scale up? So this is a proof of concept funding call. So we're looking to fund unique, innovative, and novel ideas here. So we will not be considering reinvestment as part of this funding call. If you are looking to scale an existing innovation that has been funded at proof of concept, either by Grand Challenges Canada or by another organization, I would suggest that you reach out to our transition to scale team. If you'd like us to make an introduction, you can reach out to the STARS at Grand Challenges Canada email address, and we can go ahead and make those introductions if that's relevant. I see another question here from Ayush. I hope I'm pronouncing that correctly. Given that there can be multitude risk pathways associated with a particular health risk, would you recommend mentioning and addressing all of these, even as we select one primary focus at the very beginning of the application? So you're right, select one primary focus, please. Don't select other and then put multiple. Please do really select one primary focus. In the remainder of the application, I would highlight the primary focus. So why did you select that as the primary? But if there are other, complicating factors or other risk pathways that are also affecting the health risks, as you mentioned here, you're welcome to also reflect those in your responses to the various application questions. So yes, you're welcome to address those throughout the application. That will likely provide a more fulsome picture to the reviewers and showcase your broader understanding of the challenge at hand. Okay, another question here from Kathy, and then I'll go back to the raised hands in our video call here. But so we have a question from Kathy here. Can a Canadian organization provide support to our African partners by submitting the application on their behalf due to connectivity and tech challenges? The African partner will be the project lead. So the applicant entity has to be the one whose information is provided in the application. If someone is submitting on behalf of another person or organization, the intended applicant's information must be reflected. So your African partner, organization name, location, details of the project team, the project lead, they must be reflected as the applicant institution. This is where the Canadian collaborator could be reflected as the alternate contact, so that if the project lead who is based in Africa is having connectivity challenges, any communications through the Flex system will be sent to both the project lead and that alternative contact. So Kathy, if for instance you are that alternative contact, you'll get the updates as well. Kathy, might I suggest you come off of mute to ensure that that was a clear enough response?
Yes, thank you very much. That was very helpful.
Okay, great, thanks. Okay, so going back to our raised hands here. Frank, I see you have a question. Please go ahead.
Yeah, thank you very much, Dominic. I have some questions. The first one is someone asked a similar question. The number of grants that will be granted to a particular country per time. For example, Nigeria, I'm from Nigeria. Can two organizations get the same funding or grants the same time from the country? That's number one. Do you want to answer that before I go to the next one?
Yes, please. Okay, so there'll be a total of 30 awards made as part of this funding cycle. And there is not a limit to the number of awards allocated within a particular country. We did note in the RFP that so long as there are sufficient numbers of eligible and fundable applications, we will be prioritizing at least 60% of those awards to institutions and implementation in sub-Saharan Africa. So essentially those in sub-Saharan Africa have a bit of a leg up. And the other part of your question was, am I recalling this correctly, Frank, can one institution receive more than one award? Is that it?
No, I think you've answered my question.
Okay.
The first. Okay, the second one is a startup organization just coming up, but has been working low-key in some of the states and all that. And coupled with the fact that registration of some of these organizations is not very easy in some of these countries. What do you have to say about that? Must the organizations be registered in the country?
Yes. So that is one of the essential eligibility criteria, is that any applicant to be eligible must be fully and appropriately registered within their country of jurisdiction. And so that could be as a nonprofit, it could be as a for-profit, it could be as an incorporated trust, it could be, so there's the entity type is not necessarily of particular importance, so long as the entity is registered appropriately for the type of entity that it is. So if you are a limited liability corporation, and you're in Nigeria, you must follow all of the regulations for that entity type within Nigeria. And that includes being up to date on things like your tax submission and being considered in active status with the relevant registration body. So usually there is some sort of oversight body in any country for the different types of entities at play. So that is indeed a requirement. When you refer to startups, we are definitely supportive of providing funding to young organizations with limited activity or experience. That's not a problem. Our team would likely work with particularly young startup entities to ensure that appropriate mechanisms and policies are in place to ensure to limit fiduciary risk, and to ensure proper financial management and things like that. We would require there to be an appropriately experienced financial manager or officer, things like that. But the sort of level of experience of the entity itself is not necessarily a good or a bad thing, as long as there's appropriately experienced staff or advisors contributing to the project.
Thank you. Last question now. Like I said, a startup organization that is just coming up, not experienced, getting a grant, you have to send the money to the account of the organization, and there are so many things that has to be in place. Can a partner of that organization get the grant on behalf of them through their account and sent to them, or it must be the organization's account? Thank you.
It must be the organization's account. And a point of clarification there as well is in most cases, unless it's a very large organization with really well-established financial mechanisms, in most cases we do require that grantees open a separate bank account where Grand Challenges Canada funds flow in and out directly in that particular bank account, so that the funds can be sort of segregated and accounted for.
Thank you.
Thanks, Frank. Okay, Shelly Ann Johnson. Oh, so Shelly Ann John, sorry. Please go ahead.
Hi, thanks, Dominique. One quick question. We haven't had access to the actual online application as yet, so a little bit disadvantaged to ask questions, but I'm wondering if you have a PDF version of the application so we can continue to start doing our work there.
We definitely do. I'm going to copy a link to the STARS webpage in the chat right now. And so on the STARS webpage, if you scroll down to sort of the middle of the scroll bar, there's a section that's called Relevant Round 12 Documents, and the application questions in both English and French are available there on PDF. We do also indicate within those documents specifically the character counts for the character limits for each question, because that's really important to keep in mind, because you will be sort of not able to submit if you're over the character limits on the Flux application form itself. An important note, it's character limits, not word limits. So keep that in mind as you're working on it.
Okay, thank you very much.
No problem. Stephen Ramsey.
Hi, thank you. So we actually already have a product that has been tested on the market. It's beyond proof of scale, proof of concept and transitioning to scale. However, what we would like to test with GCC funding is how we can adjust our sales pitch to include water testing kits in the sales kit. So when I get to the question that asks how we plan to sustainably scale beyond the funding period. I'm wondering, since it's so integrated with our overall scaling plan in Kenya, do you want to see that question answered specifically on the what the GCC grant is funding, or how it fits overall with our scaling pathway in Kenya?
Gotcha. So Stephen, am I understanding correctly that you're essentially wanting to test an add-on component of your existing product, right?
Yeah.
Okay.
Yeah. Basically.
So I would definitely suggest that you answer that question, within the broader picture. So because you would never scale this as a standalone, you're really seeking to assess whether it's, appropriate, feasible, whatnot, to add this as a component onto your existing product. And so this would be definitely part of your broader sort of scaling efforts. So I would answer the question with that in mind for sure.
Okay, excellent. That's the answer I wanted to hear. I was thinking it would be a little bit tough to specifically answer that one question with the add-on. So thank you so much.
Not a problem.
Yeah.
Thank you. Patrick, I see you're raising your hand here at the bottom of my screen. Please go ahead.
Okay, thank you so much. I wanted to ask, do you also fund projects like we're into aquaculture, that's fish farming here in Zambia? So I wanted to find out if at all maybe there's the possibilities of us submitting also an application, because we want to expand our business. We've been in existence for some time now, from 2019, but we're thinking about we can expand our business.
Patrick, did I catch correctly that it's an aquaculture business that you're?
Yes.
Maybe. So you would need to be able to address the questions in the application as to why the aquaculture project is, addressing climate sensitive health risks in the communities in which you would be working. So it would be dependent on how your team is able to sort of fit the project within the priorities of the call. So I would say it's not out of scope necessarily, but you would need to very clearly make the association.
Okay, I get you. But the second question is, how long do you take for you to fund the projects?
Let me go to I don't know the dates off the top of my head, so I'm just going to that section in our RFP. So give me just a moment. And I can't find it, of course. So we would be, let me look at another document I have here. We would be going through the review stage. So project applications close January 23rd. And then we would be going straight into the initial eligibility screen, and then into the first, formal step of the review process, which is the innovation screen, and that will take place in February. And then in March and April, we would be doing we would be conducting the peer review. And then we would move on to analysis and assessment of that peer review, which generates the fundable list of projects. And then we'd be identifying the top ranked projects that we would move forward to select. And that would happen in May. So results notification for those selected for funding would happen mid-May. And then we expect negotiations to take anywhere from 3 to 6 months, depending on how quickly a team can move, depending on how complicated the negotiations are. So we generally would expect funding and projects to start in about September of this year.
Thank you. Thank you.
Thanks, Patrick. Okay. Again, on the video call here, Septia, please go ahead with your questions.
Okay, thank you, Dominic. Hi, everyone. So I understand that you don't fund the mitigation efforts such as clean cookstove, but our program is intended to reduce the impact of poor air health quality, where one of the intervention is clean cookstove. Is it possible for us to apply for this funding?
And would you be monitoring the actual impact on the health of the individuals to whom you are providing or working with clean cook stoves?
Yes, absolutely.
So in that case, if you're actually monitoring the health outcome rather than sort of the outcomes related to the change in cooking fuel, then you can make a case for that.
Okay, thank you.
Yeah. Thank you, Septia. Livia Savard, please go ahead with your question.
Hi, thank you for bearing with me. Connection in Abuja is not very great. I have some questions about eligibility just because it's not clear. So we are obviously a INGO, but we have been active in Nigeria for 9 years. We work in collaboration with sort of the government, the Nigerian Center for Control of Disease and everything. We work with hospitals inside of Nigeria. We were wondering so we are currently looking at the effect of the climate change on like Lassa fever specifically, and like hemorrhagic fevers. That would be what we would look into. Is the collaboration we are doing with the local hospitals would be considered all right in terms of the sort of the request for collaboration, or would it not a local collaborator? Were you able to hear me?
Yeah, so Livia, am I understanding correctly that you're wondering if the local hospital is an appropriate project collaborator under this RFP? Is that correct?
Yes, yeah.
So yes, absolutely. Livia, where is your institution who would be the applicant? Where is that institution registered?
We're registered in France, US, Canada, and the UK. So
okay, so you would need to apply through your Canadian body.
Very recently. Okay, perfect.
Yeah.
But the local hospital would be considered all right. We were not sure because of the governmental institutions.
Oh, right. Yeah, no, that would be fine as long they're a collaborator, they're not a direct applicant. So that makes it much less complicated. But yes, definitely make sure you apply using the information of your Canadian registration.
Yes. Thank you.
And that's where we would have to send the funds, and then that Canadian body would need to send the funds through to Nigeria, just so you're clear on that.
Yes. Perfect. Okay. Thank you so much.
No problem. Okay, I see my colleague Gloria has noted down a couple questions from the chat, so I'll address those. So there's a question from Alethea. So I'm aware that the focus is meant to be around health challenges which are being worsened by climate change, but what about innovations which respond to consistent health needs, but with less of an environmental impact than current interventions, providing health solutions which require less water or produce less waste. Therefore, it's not the health issue being worsened by climate change, but that our solution can manage the health issue with smaller environmental impact. Unfortunately, that's just not sufficiently aligned with this particular call, Alethea. So we're really looking for innovations that address specifically health issues being worsened and exacerbated by climate change. That really is the focus of this call. So while we certainly appreciate the efforts of those other projects, it's just not sufficiently aligned to this particular call. But not to say that that might not be appropriate for calls in the future. Another question here from Beatrice. Is if a startup organization registered with the government is yet to access any funding before now, but has a network of volunteers and advisors who can successfully develop and implement interventions, is that organization eligible to apply for funding? Yes, so long as that organization is indeed fully and appropriately registered and has, what either the volunteer, advisory, or actual staff to implement and move forward with the project, that's not a problem. I would certainly suggest that, after application, you go through your internal policies and make sure that there are, financial management policies in place and things like that. That'll just make your life, if you're selected as a project, easier during negotiations, because our team will certainly ask about that kind of thing at the negotiation stage if you get that far. Okay, I see another question here. Will the grant fund multi-country projects? Yes. If implementation is taking place in more than one country, you're able to select more than one country of implementation in the application form, or you should be. If you have an issue with that, please let us know. I would suggest that the team really takes a, thoughtful approach to whether the timing, 18 months, and budget cap of 150,000 Canadian dollars is sufficient to actually implement in more than one country. Be realistic about what is achievable within those time and funding constraints. If the team feels that it is indeed feasible to do that, please, make the case and just reflect on how you're making that case to the reviewers. Are the reviewers going to assess this as being feasible? Why does your team think they have the capacity within those constraints to implement in multiple countries? Are there perhaps already teams or established collaborators in both of those countries making, implementation more straightforward or a little bit easier, things like that? So just know that the reviewers are going to probably take a little bit of a deeper look at the feasibility of implementation across more than one country. I see another hand raised here. Birchman's Uimana, please go ahead with your questions.
Yes, thank you so much, Dominic. I have 3 questions.
Sure.
But actually the first one was a little bit answered. It was about the size of the organization. But maybe one specification that I want to hear about is if this specific call is for the nonprofit organizations only, or if the social enterprises are also accepted.
Yes, we would love social enterprises to apply.
All right, thank you. So the second one is about the section that we have in the application, which is about the climate sensitive health risks.
Mm-hmm.
I saw a particular area where there is NCD, and in the parentheses we have cardiovascular and cerebrovascular. Is this a specific niche to the application, or is it just an example of NCD?
Just an example of NCDs, so not a particular highlighted. We just wanted to sort of offer a couple examples. So. Okay,
thank you so much. So the last one is the section B, question 2. Where we have to speak to our innovation and how to integrate scientific, social, and business sustainability. Does that mean that every idea should speak to the 3 components or the triad, or it can just have like 2 or 1? Just more clarification about it.
Thanks. Yes, so absolutely. Not every application will address all 3, and that's fine. Certainly, I would try as hard as you can to make the case for at least 2. though it's not absolutely required. You're not going to be, dismissed as ineligible if you're only addressing one. I would say the reviewers would sort of question if you're only addressing one of those components. In most cases, there should be at least two. Yeah, so I would just take a look through that, but certainly if you only address one, you're not going to be ineligible. But the reviewers, are going to maybe ask a few more questions at that point.
Last one, is there a specific profile of the project lead that you are looking into, or it doesn't matter?
Doesn't matter. We're not particularly concerned about the project lead, other than, they should be appropriately experienced within the area that your innovation is seeking to address. They should have project leadership, some project leadership experience. If they're, for instance, perhaps you are talking about, a young social enterprise with a younger, project lead. If that's the case, where there is limited experience on the part of the project lead, in the collaborators section, I would suggest you indicate, where perhaps you're getting more technical or advisory support from, to sort of bolster and make that team more, that the view of that team more comprehensive.
Thank you so much, Dominic.
Not a problem. Thank you. Okay. I see another question from the chat here. So the health issue has to be caused by climate change. So no, to clarify, I mean, the vast majority of health issues that we're talking about exist and have been being addressed for many, many years. We're looking to address through these innovations health issues that are being worsened by the impacts of climate change. I think we have a situation where the health issue is ongoing, but the current solutions that the health issues are not eco-friendly and are contributing to the climate issue, but ours addresses both the health issue and climate issue together. So, Kristen, can you come off mute, and maybe we can just get a little bit more clarity on this. Also, I'm just noting it's 10:31, so a minute past our intended close time. If you have to jump off, please go ahead and do so. We'll continue recording to the end of this call. Gloria and I have another 15 minutes at least, so I would love to just get through as many of these questions as we can. If you do have to jump off and we have not yet addressed your questions, please send an email to stars@grandchallenges.ca and we'll follow up via email. Thank you, everyone who has to jump off. Thank you for joining us. We appreciate the thoughtful questions that you've come with, and we can't wait to see and read through your applications as they come in. That being said, Kristen, if you're still on the line and you're able to come off mute, please go ahead with some clarification.
Yes, hi, thank you so much. Basically, I was just wondering, because one of the health issue that we're addressing, basically it's I guess in some ways the solution for that health issue is something where it's not an eco-friendly solution or sustainable solution currently, like the solution that's being used today. And so what we're trying to provide is something that's an alternative to that, or like an eco-friendly, sustainable alternative. And in doing so, we're able to address both the solution to the health problem that's being created, that's there in the first place, as well as the fact that the solutions that are being used for that health problem are not eco-friendly, if that makes sense.
Yep, it does make sense. But so is the health issue itself being worsened by climate change and the geography in which you're intending to work?
I would
say, is it just that the
say
solution is not eco-friendly?
I would say it's like the effects of it are worsened because of the temperatures. Actually, part of the reason that there are issues is because of the hotter temperatures. That causes more like rashes, irritation, and issues with the products. Okay,
so then I would say if you lead with that, right? Lead with that being the climate pathway, heat stress, perhaps something along that lines, being the climate risk pathway through which the health issue is being worsened. I think that's how you might be able to make the case to reviewers that this is sufficiently aligned. The focus on the eco-friendliness or the less climate impactful of the solution, like that's not what's going to make a sufficient case for this innovation as part of this particular funding call. So you'll have to sort of frame it from the other side, and I understand that that might just be, in your case, a framing issue, but that's how the call was drafted. And so sort of to make your case to align with the call, that would be my suggestion, would be to focus on the heat stress as the sort of climate risk pathway.
Okay, great. Thank you so much.
Thanks, Kristen. I don't see any other hands raised on the video call right now, but there are a couple more from the chat. So can an organization that is not, this is from Lucy, can an organization that is not a lead participate in more than one project? So I'm imagining, Lucy, that we're talking about a collaborator participating in more than one project. And yes, that's not an issue. In fact, a single institution can apply for more than once for different innovations. So you can't apply for one innovation worded differently in two applications, but so long as we're talking about two different innovations, an application can apply more than once, but it needs to be different project leads for each application. And then I see a question here from Irene. Is there any general idea of the population that should be positively impacted, as in number of people directly impacted or potentially impacted in the future? So we would be most sort of interested in knowing the number of people directly impacted through the GCC funding during the GCC funding period. And in terms of numbers, is really aligned with sort of when we talk about depth of impact versus breadth of impact. If the depth of the sort of innovation is going to have, be sort of life-changing for the individuals with whom you are working, we would expect, it would be acceptable to have a smaller sample size. If it is sort of a lighter touch innovation, that doesn't necessarily have the same depth of impact, but does, of course, have a beneficial impact to those participants, we would expect there to be a larger sample size. So for instance, if it's a digital solution of some sort, we would expect, there to be several hundred, if not potentially thousands of participants. And when we're talking about the population you're working with, we can distinguish also between those you're reaching, so the participants that are going to be using the intervention versus the population that you're going to be following and evaluating and assessing for impact. You may be, there may be sort of reach targets in the thousands, but based on the limited time and funding available to you, maybe following and assessing impact with a sample of, say, 150, for instance, is appropriate. So it also has to do with the type of evaluations you're going to be doing, and sort of this is where it'll come to the value for effort criteria for the peer reviewers. They're going to be considering this kind of thing. Does that make sense, Irene? Is there any follow-up questions there? Is that sufficient?
That was great. Excellent.
Wonderful. Great. Binush, please go ahead with a follow-up.
I just raised my hand more than once. Okay. So there was this discussion around we should be monitoring the health outcome. And I was just thinking about the indicators that we proposed, because the long-term outcome of the project that we are proposing, aka impact, is not something that we can measure during the course of the project because we are focusing on decreasing malnutrition. But what we are proposing is to measure, I would say, immediate or intermediate outcome, which is more to do with improving food insecurity or food security in the community and access to the variety of food and everything. Would that be acceptable? Because there is no way that we can just see any change in malnutrition.
Yeah, that's totally understandable. That's something forever at STARS that we've been dealing with, no matter, you know, the focus on climate versus on sexual reproductive health, for instance. The challenge with these short, you know, pilot proof of concept periods is always that you're limited in what can be assessed and evaluated. And so as long as you make a case within the application, especially for these expert reviewers, why you're choosing sort of an immediate outcome indicator to evaluate versus the longer outcome metric, that's totally acceptable. If you can, you know, support the decision to assess one versus another with, you know, with the literature, if you can back it up with the literature to indicate that yes, these are indeed sort of proxy earlier stage metrics that connect to the longer term outcomes that you're seeking, that's even better. So it's just about justifying why you'd be assessing those metrics versus the longer term outcome ones.
Brilliant. Thank you very much.
Thank you. I see oh, that was you, Panish. Okay. All right. Our last few minutes together, are there any other questions that we have not addressed as of yet? I think we got through a lot today. So thank you all for joining us. I see Gloria has put a couple messages in the chat here. Please do reach out to us as she's indicated on the Stars at Grand Challenges email address if you have any follow-up questions, if we weren't able to get to your question. And we really appreciate everyone for taking the time to join us today. It's always great to see these questions come in and to engage with our potential applicants. And yes, as I said earlier, we really look forward to reading through all these exciting applications. So keep them coming. Paul, did you have a question you wanted to ask?
No, I don't have any questions.
Okay.
Thank you to Gloria. She translated for us.
Yeah, Gloria was answering in French.
No problem.
Thank you very much. Thank you to Gloria.
Thank you. Thanks for being here.
Great. So I'll end the recording now. And we will be posting this recording on our YouTube page. So once again, thank you all for joining us today. We really appreciate you taking the time and for your interest in this funding call. Thanks, everyone.